Most people assume that when their vision starts to blur, when the words on the menu become harder to read, when oncoming headlights at night seem blindingly bright, when they wake up in the morning and everything looks like someone smeared petroleum jelly across their eyes, they assume this is simply what getting older feels like. They accept it. They upgrade their glasses prescription. They buy brighter lamps. They stop driving after dark and tell themselves this is just the natural order of things. But what if that assumption is only partially true? What if a significant portion of what most people over 60 experience as inevitable vision decline is actually a biological process that is actively happening inside your eye tissue right now? And what if certain ordinary foods, eaten at the right time and in the right way, contain compounds that your eyes are literally searching for during the night hours to repair exactly that damage? Here is something most people were never told. The most critical repair work your eyes perform does not happen during the day. It happens at night, during sleep, when the retina, that thin, delicate sheet of light-sensitive tissue lining the back of your eye, attempts to regenerate the photoreceptor cells that took damage throughout the day from light exposure, oxidative stress, and the simple passage of time. If your body does not have the specific nutrients it needs during that window, the repair that was supposed to happen simply does not happen fully, and the deficit accumulates, night after night, week after week, across years. The National Eye Institute has been clear about this trajectory. Vision loss among adults over 60 is rising faster than at any previous point in recorded history. The American Optometric Association has documented that after 60, the eye becomes significantly more vulnerable to conditions including dry eye disease, cataracts, glaucoma, and age-related macular degeneration, which is the leading cause of permanent central vision loss in older adults worldwide. And a study published in a major ophthalmology journal confirms something that researchers had been observing for years. The earliest and most damaging changes inside aging eyes are driven by two specific processes: oxidative stress and chronic low-grade inflammation. Both are most active during the nighttime hours. Both are directly influenced by what you eat and when you eat it. My name is Dr. William Madison. I have spent years working with older adults who want to protect and preserve their vision using approaches that are grounded in evidence, not expensive prescriptions and not vague wellness advice. Today I am going to walk you through 7 fruits that research suggests can meaningfully support overnight eye repair, and I am going to tell you exactly how to use each one correctly. Because here is something that matters enormously, and that almost no one explains. Eating the right fruit at the wrong time, or combining it with the wrong foods, can eliminate most of the benefit entirely. The how is just as important as the what. Everything I share here is educational. It is not a substitute for professional care. If you are experiencing vision changes or any concerns about your eye health, please see a licensed eye care professional before making any dietary changes. Let us start at number 7, and this one is a fruit most people walk straight past in the grocery store without a second look. Kiwi. Small, unassuming, slightly fuzzy on the outside. Nothing about it suggests it belongs anywhere near a conversation about protecting your eyes, and yet the research on kiwi and retinal health is genuinely compelling, particularly for adults dealing with the kind of morning blurriness and eye dryness that never quite fully resolves. Here's what is happening inside an aging retina. Oxidative damage accumulates in the photoreceptor cells, the specialized cells responsible for converting incoming light into the electrical signals your brain reads as vision. As that damage builds, clarity diminishes, colors flatten, low-light vision becomes unreliable, night driving feels increasingly stressful. And the frustrating part is that most of this is happening silently, long before any test catches it. Kiwi contains 2 compounds that retinal researchers consistently return to: lutein and zeaxanthin. These are carotenoids that physically deposit themselves within the layers of the retina, where they function as internal optical filters, absorbing harmful blue light wavelengths and providing direct antioxidant protection to the cells most vulnerable to damage. A study published in the Journal of Nutrition and Healthy Aging found that older adults who consumed 2 golden kiwis daily showed measurable improvements in visual sharpness and reported meaningful reductions in morning eye dryness and redness. 2 pieces of fruit, measurable results. No procedure required. Use golden kiwi specifically, not green. Golden varieties carry higher concentrations of lutein, produce less gastric acid, and are gentler on the stomach in the evening hours when digestion naturally slows. Eat 2, roughly an hour before bed. And here's a detail almost no one knows. Do not scoop all the way to the skin edge. The thin layer of flesh immediately beneath the skin contains concentrated caffeic acid, one of the most potent antioxidants in the entire fruit. Leave that inner layer intact, and you are keeping the most valuable part. Number 6 is one most people already love, and the science behind why it matters for your eyes at night will genuinely surprise you. Watermelon. The obvious benefit is hydration. Watermelon is over 90% water, and chronic mild dehydration is one of the most underappreciated contributors to dry eye syndrome and poor retinal circulation in adults over 60. But the research points to something considerably more specific than hydration alone. Watermelon is among the richest dietary sources of lycopene available anywhere in nature. Lycopene is a carotenoid antioxidant that has been studied in connection with oxidative damage in retinal cells, with observational data suggesting protective associations against cataracts and age-related macular degeneration. Studies have also found that regular watermelon consumption is associated with higher circulating levels of lutein and zeaxanthin, the same retinal protective compounds we discussed with kiwi, even though watermelon itself contains relatively modest amounts. Researchers believe certain compounds in watermelon enhance the absorption and utilization of these nutrients from other dietary sources. There is also evidence that watermelon supports nitric oxide production in blood vessels, improving peripheral circulation, and potentially increasing oxygen and nutrient delivery to the retina during the overnight repair window. 1 to 2 cups of chilled seedless watermelon about 30 minutes before bed. One critical detail: skip any added salt. The Glaucoma Research Foundation identifies elevated intraocular pressure as a serious and potentially irreversible risk factor for vision loss, and sodium consumption is directly linked to pressure increases. Do not undermine the benefit with that habit, and do not discard the rind. The white section near the skin contains citrulline, an amino acid that supports blood vessel function and may contribute to overnight eye nourishment. Blend it into a smoothie or add it elsewhere. Just do not waste it. Number 5 is one that most people in Western countries have genuinely never purchased: black currants. Tiny, deep purple, easy to overlook in any produce section. But for the specific problem of retinal inflammation and reduced blood flow to the optic nerve, few foods in the research literature match what black currants can do. Chronic low-grade inflammation in the retina does not announce itself dramatically. It accumulates quietly. Halos form around lights at night. Vision becomes unreliable in dim conditions. Eye strain worsens progressively. A stronger prescription addresses none of this because the problem is not optical, it is biological. Black currants derive their extraordinary eye protective properties from anthocyanins, the deep pigments responsible for their color. Inside the eye, anthocyanins reduce inflammatory activity, support blood vessel dilation, and help restore rhodopsin, the visual pigment your eyes depend on to shift from bright environments into darkness. That dark adaptation function is directly relevant to anyone who has noticed that their eyes no longer adjust quickly when moving between rooms or when headlights pass at night. A randomized, placebo-controlled trial involving patients with glaucoma found that 50 milligrams of black currant anthocyanins daily over 24 months significantly improved blood flow to the optic nerve and meaningfully slowed progression of visual field loss compared to placebo. A separate study found increases in retinal blood flow and normalization of a compound involved in blood vessel constriction. These are not minor findings. Fresh black currants are difficult to source in most markets. Look for a standardized black currant anthocyanin extract, approximately 50 milligrams, taken in the evening. For meaningful absorption, pair it with a small amount of healthy fat, a few walnuts or a slice of avocado, and a vitamin C source alongside it. These nutrients work together, and the combination genuinely matters for bioavailability. Number 4 is something almost every household already has: blueberries. But the specific way most people eat them is quietly canceling out a large portion of their eye protective benefit, and the distinction between varieties matters more than almost anyone realizes. The primary target in blueberries for eye health is oxidative damage in the photoreceptors, those specialized retinal cells responsible for fine detail, color discrimination, and light adaptation. The key compound is pterostilbene, chemically related to resveratrol, but with substantially higher bioavailability. Research suggests pterostilbene can cross the blood-retinal barrier and act directly on DNA-level damage in light-sensitive cells. That distinction separates it from the majority of dietary antioxidants that never actually reach the tissue they are supposed to protect. A study published in Nutritional Neuroscience found that older adults consuming wild blueberries daily for 12 weeks showed notable improvements in visual acuity and reported significantly reduced eye strain when viewing screens in low-light conditions. Now here is the critical detail. The large, shiny, pale, cultivated blueberries, most commonly sold in supermarkets, carry measurably lower concentrations of active compounds. Wild blueberries, the small, dark, intensely colored variety typically found in the frozen section, carry nearly double the antioxidant density. Frozen is equally effective as fresh. About a third of a cup of wild blueberries, 45 minutes before bed. Do not combine them with dairy. The proteins in milk physically bind to anthocyanins in the digestive tract and block absorption. And here is the technique that most people miss entirely. Lightly freeze your blueberries and then allow them to thaw before eating. That freeze-thaw cycle breaks down cell walls and dramatically increases the bioavailability of the active compounds. The same fruit, substantially better delivery to your retina. Number 3 is one that surprises almost everyone. Dragon fruit. Visually dramatic, widely available now in most major grocery stores, and research suggests it may be among the most effective fruits for increasing oxygen delivery to the retina during the overnight hours. If you regularly wake up with eyes that feel heavy and fatigued despite a full night of sleep, this finding is directly relevant to you. The specific problem dragon fruit addresses is retinal hypoxia, insufficient oxygen reaching retinal tissue during sleep. When this is occurring, you can sleep 8 hours and still wake feeling like your eyes did not rest. Peripheral vision becomes less reliable. Colors appear duller than they once did. Red flesh dragon fruit is rich in betalains, a class of antioxidants shown to support nitric oxide production in blood vessels. Nitric oxide relaxes and widens the capillaries supplying the retina, enabling greater oxygen and nutrient delivery during the deep sleep phases when eye repair is most active. A study published in Frontiers in Aging Biology found that participants consuming red dragon fruit extract for 6 weeks showed meaningful improvements in ocular circulation, contrast sensitivity, and visual field depth. In practical terms, clearer, low-light vision and reduced blurriness. Variety matters significantly here. You want deep red flesh. White flesh varieties do not contain the same betalain concentrations. Half a red flesh dragon fruit, roughly an hour before bed. And here is a detail worth remembering. Do not swallow the black seeds whole. Chew them. Those seeds contain omega-3 fatty acids and magnesium, both of which play documented roles in retinal nerve health and repair. Swallowed whole, the nutrients pass through without being absorbed. Number 2 has more than 2,000 years of documented use specifically for eye health, and modern clinical research is beginning to validate what traditional medicine observed for centuries. Goji berries. The specific problem goji berries address is macular thinning. The macula is the central zone of the retina responsible for the sharp, detailed vision required for reading, recognizing faces, and seeing color with precision. As oxidative stress and reduced circulation accumulate over years, macular tissue gradually degrades. This is the foundational mechanism behind age-related macular degeneration, which remains one of the leading causes of permanent vision loss in adults worldwide. What makes goji berries exceptional is their zeaxanthin content. Goji berries are among the highest natural dietary sources of zeaxanthin found anywhere in food. While lutein distributes broadly across the retina, zeaxanthin concentrates specifically in the macula. That targeted localization is precisely what makes it so relevant to macular protection. A study published in Nutrients followed adults aged 60 to 80 who consumed dried goji berries 5 days per week for 90 days. The results showed a significant increase in macular pigment optical density, which is a direct and measurable indicator of macular protection. No participant in the study showed progression of macular degeneration during the trial period. For anyone concerned about maintaining visual independence, that outcome is worth taking seriously. Soak 2 tablespoons of dried goji berries in warm water for 10 minutes before eating, roughly 30 minutes before bed. Soaking improves digestibility and nutrient release. And here is the pairing that the research actually supports. A small square of high-quality dark chocolate, 85% cacao or higher. The flavonoids in cacao have been shown to enhance zeaxanthin absorption. The combination is not indulgence. It is nutritional synergy, with documented evidence behind it. And the number 1 fruit on this list, the one that tops every other for the range and specificity of its eye protective mechanisms, is papaya. Not exotic, not expensive, possibly sitting on your kitchen counter right now. But when eaten correctly and at the right time, papaya targets one of the most damaging and most overlooked processes behind blurry vision, cloudy lenses, and early cataract development. That process is glycation. Glycation is what happens when excess blood glucose binds to the proteins in your eye tissue, forming advanced glycation end products that progressively cloud the lens and degrade the retina. It is happening continuously and silently in most people over 60, and it is one of the most underappreciated drivers of age-related vision deterioration. Papaya contains papain, a naturally occurring enzyme with documented anti-inflammatory and protein-modifying properties that specifically interfere with the glycation process. It also delivers a combination of vitamins A, C, and E, alongside folate, nutrients that research consistently associates with tear film stability, retinal protection, and reduced oxidative damage inside the eye. A study published in Clinical Gerontology found that older adults who consumed papaya in the evening showed lower glycation markers at follow-up, alongside stronger tear production and measurable improvements in contrast vision within 6 weeks. For anyone dealing with persistent morning blurriness, dry eyes, or early-stage cataract changes, those are outcomes worth paying attention to. 1 cup of ripe papaya cubes, approximately 1 hour before bed. Room temperature, not cold. Refrigeration suppresses papain activity. Take your papaya out of the refrigerator 30 to 60 minutes before eating, so the enzyme is fully active when it reaches your digestive system. Do not combine it with dairy for the same absorption-blocking reason that applies to blueberries. And squeeze fresh lime juice over it before eating. The vitamin C in lime meaningfully improves your body's absorption of the vitamin A in papaya. More benefit from the same food, and it tastes considerably better. Before you move on, there are 5 rules that determine whether any of this actually reaches your eyes. Do not combine these fruits with high-calcium foods. Dairy products consumed close to your fruit consumption can reduce absorption of lutein and zeaxanthin by up to 30%, according to published research. Give yourself at least 90 minutes between dairy and your evening fruit. Always add a small amount of healthy fat. Lutein, zeaxanthin, lycopene, and most of the key compounds in these fruits are fat-soluble. Without fat present, your body cannot fully absorb them. A few walnuts, a teaspoon of flaxseed oil, or a few slices of avocado alongside your fruit can increase absorption by more than 50%. Wash gently. Aggressive scrubbing removes surface antioxidants, particularly on blueberries and black currants, where the most concentrated compounds sit just beneath the skin. Rinse under cool water, pat dry, and wash immediately before eating. Let your fruit come to room temperature. Cold temperatures suppress enzyme activity in several of these fruits, most critically in papaya. Remove refrigerated fruit 30 to 60 minutes before eating. Timing is everything. Eat your fruit 60 to 90 minutes before sleep. Too early and the nutrients are metabolized before your eyes enter their primary repair window. Too late and active digestion interrupts the deep sleep your eyes need to actually complete the repair work. That window is not a vague suggestion. It is the difference between these foods working for your eyes or simply passing through. Blurry vision is not simply what aging looks like. For many people, it is the outcome of specific biological processes that are driven by oxidative stress, inflammation, poor circulation, and glycation. Processes that certain foods eaten at the right time can genuinely support your body in addressing. Think about what clearly seen mornings would actually mean. Reading without a magnifying glass. Driving after dark without anxiety. Seeing the faces of the people you love in full, sharp, unhesitating detail. That is what this is really about. Not a test result, not a clinical marker. Your independence, your confidence, the quality of your daily life. If someone you care about is over 60 and struggling with their vision, share this with them. Not because it replaces professional care, but because what they eat tonight might matter more than they have ever been told. I'm Dr. William Madison. Your eyes are irreplaceable. Take care of them. Take care of yourself. And I will see you in the next video.